Prehospital transfusion is getting blood products into emergency medical transportation vehicles ahead of time so that when patients may have a traumatic bleeding episode, they are able to access blood products before actually reaching the hospital.
Neither one of our local hospitals is a designated trauma center, so that presents some interesting issues when we are dealing with patients with traumatic disease. All of those patients have to be transported to the university in Columbia, which is about a 35-minute ground transport from downtown Jeff City. We get out into the county, now you're looking at exponentially larger response times.
I moved here to St. Louis after 10 years in the military. After 10 years in the military, we were transfusing blood overseas in Afghanistan and other countries where there's active conflict going on. What we saw from these transfusions is that providing blood early on in the injury process greatly increases the life expectancy and the outcomes of our patients.
Here at ImpactLife, we are working really closely with so many EMS partners to help bring blood products into those emergency vehicles so that when they are out and it's needed, they have blood available to them.
So we've been live with our blood products for about 90 days now. In those 3 months, we have transfused 3 different patients.
Pre-hospital transfusion can make the difference between life and death for a patient. When a patient has critical hemorrhage, replacing blood volume with IV fluid, saline or lactated ringers can actually worsen outcomes. Having blood present can make a critical difference in the outcome for the individual patient by being able to administer the product that they need, not just fluid to try to expand the volume.
So we provide O red cells for our pre-hospital transfusion programs. This is universal blood, and we're really just so grateful to our generous donors, and this is where some of those blood products are going today. This is liquid plasma. You could see this is the liquid part of our blood. When a patient is suffering from a traumatic bleed, this is the unit that helps their blood stick together so that they can form a clot and stop the bleeding. There are groups that are being established that are donating just for this cause. So if we're able to get blood faster to the patient, it's really going to help save lives.